Hello, welcome to Health Alert. I'm Pam Butler. Today we're going to talk about immunizations or vaccinations, and joining me is Kathy Siebert. She's with the Tulsa Area Immunization Coalition, and she is with the Tulsa Health Department. Welcome to the program.
Thank you very much, Dr. Butler.
Now, when we start here, and just call me Pam.
Okay.
When we start, I want you to first tell us a little bit about this concept of immunizations. Is it really a big need, a big issue, not just here in Oklahoma, but what we hear about within the U.S.? Tell us how we should view this.
It's always a big need. Immunizations are preventatives. This is something that in the pre-vaccine era, before we had these wonderful vaccines to prevent vaccine-preventable diseases, we had so many cases of diseases that would cause brain damage, or for example, polio would paralyze about 15,000 children per year in the United States. And pertussis, about 8,000 kids per year would die from whooping cough, is what they call it commonly. Okay. And most of those kids were less than a year of age because they were so vulnerable being so young. Okay. And measles, which a lot of us my age remember having measles and mumps and the different diseases like that they just considered part of childhood. But if you have a medical problem, or if someone in the family has a medical problem, they're compromised a little bit. They're less able to fight off the illness. And so not only are we protecting those children that are getting immunized, or adults, because there are vaccines for adults, but we're protecting other members of the family. Okay,
now let me ask this question, then we're going to get more specifically and look at each disease as well. Immunization, vaccination, I mentioned both. Sometimes people get confused. Is there really a difference when we use those terms, or not really?
They're used interchangeably. Okay. Even before that, they used to say inoculation, and that's from the very first vaccine that was developed for smallpox or cowpox. So it's just an interchangeable term.
Okay. Now, when we think about our immunizations or vaccinations, and we think about how young people should really get them, before we get into what these are really and the age, I want to talk a little bit about myth. That's why I sort of talk about how young. What are some of the myths that are associated with vaccinations? I mean, I've heard myths, and some people say it's not a myth, some say it's a fact, that it can cause other diseases such as, or conditions, such as autism or things like that. But what's really happening in these areas?
Well, there's at a time where we don't see many of these diseases anymore, it seems to be that the fear of the disease is gone. People don't know about that, but we have more vaccines, and so they have kind of changed that out to be a little more fearful of so many shots. And no parent wants to go to the doctor and take their child and see them have to get some shots. But that's what's necessary to make sure that they're immunized properly. So we have had some concern in the community by parents about different vaccines and different outcomes. Just a regular outcome would be you go and you get a shot and your arm is sore, or you run a little bit of a fever. And that's just a very small reaction, and the job is being done by the vaccine. That's part of the deal. But some children, and it's not very many, but some children may have a bigger reaction than that. They have had a whooping cough vaccine in the past that was made a different way, and it caused, at the time, children to maybe be irritable, and they would cry for hours at a time. And they have improved the vaccines over the years. They never let their monitoring go on vaccines. And if there's a time they need to pull one away, and not offer it anymore, they will do that, and they have done that in the past.
So they really haven't found a strong link to any particular vaccine or immunization for a major condition that we're seeing. Right now, there really isn't that kind of a linkage.
There isn't a linkage. I know the autism was a very hot topic in the last couple of years, and what scientists do when that comes up, they try to reproduce what's being said is happening because of a vaccine. And when they can't reproduce it, and they have all the scientific evidence that shows it can't be reproduced, then they know it's not the vaccine that's doing that. We had a study that was done a few years ago that came out. The physician in England, his last name was Wakefield, and the study was done on a very small amount of children, less than a dozen. And he came up with some really pretty wild conclusions to those studies. And when scientists and people that work in immunology and vaccinology tried to reproduce those, they couldn't.
Okay.
And there is a Autism Science Foundation that has parents that's children are autistic, and they recognize that vaccines were not the cause of their children's disease, and they are working towards finding out what other things are might be causing them, and see if they can tackle that problem. And now the scientists have said, well, you don't have to worry anymore. We've already tried, and we know that it doesn't cause it.
And so that's the good thing to know, and to really look at our research before we maybe sort of conclude that this happened, so it had to be that.
Right.
Versus it just could have been a coincidence that you had that and then this happened.
Children are developing, when they're infants, they're very small, and they develop some of the problems start showing up. And if it's any time near the time they've had an immunization, the likelihood is they're trying to find something that might have caused that, and a lot of times in the past they thought that that's it.
Okay, now when we look at vaccinations in general, and we will get specifically about the different types like DPT and all of that and what that means, how young should children begin to be immunized? I mean, is it 2 months, 4, or what is it?
Well, the hepatitis B vaccine, they're able to give at birth, because they find if they give it as soon as possible, it'll have the greatest effect, and it can prevent liver cancer and liver disease decades later that can develop if they get the kids started right away. And so that starts at birth. But normally we do remind parents that at 2 and 4 and 6 months, and then a year, they should bring the children in, the little infants in, so that they can have well baby checkups.
Okay.
There are times that they might bring them in and they're fussy and they're a little bit ill. You know, they have a cold or something. They can still immunize them during those times.
Okay.
But the physicians are well trained in knowing when it's not a good time to immunize them. They don't want to put that little extra bit of effort that the child's body needs while they're in the midst of having something, an illness that's a little more major. And so they're very careful to do that.
And that's a good thing, because when you think about it, like you mentioned that vaccination, it can be something that helps sustain your life later down the road when you're into the adult years, that people maybe don't make that strong of a connection with. So I do want to say this. I know within Oklahoma, I'm not sure with all states, and people will have to check, parents can have the option of exempting their children out of certain immunizations, if not all, for certain kinds of reasons. Again, when you do that, what can be some of the consequences, quickly you mentioned, in terms of risk factors of even others exposed to that child?
Right. Well, there are personal exemptions because of like medical exemptions. There's one called philosophical. That's because you don't believe you want to do that.
Different reasons.
So they have several different exemptions, and they do vary from state to state, so you need to check and see. But an immunization or a choice to immunize a child carries a risk. And as long as the parents or the person understands what that risk is for that child, then that's something they have to consider. And talking to the physician or the clinics that immunize children, they can help you decide if that's something that's important to you.
Okay. Well, what I'm going to do, Kathy, is take a really quick break. They're telling me I need to take one, and I'm going to come back and pick up on that point, because sometimes we also don't consider other people in the environment and their status in terms of condition of health. So we'll be right back. Stay put. And you stay put. We'll be right back.
Clean kitchen surfaces, utensils, and hands with soapy water. 1 in 6 Americans will get sick from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
She talks to that more than she talks to him. What's up, bro? Nice shirt. Who's she talking to? Her mom? She talks to her mom a lot.
Welcome back to continue our discussion talking about immunizations and vaccinations. Joining me again is Kathy Siebert. She's with the Tulsa Area Immunization Coalition and the Tulsa Health Department. Now let's jump in. I wanted to pick up again on this situation. If you decide to take an exemption, sort of the thought process that you need to also not look at your child, but who is in your environment, because you can have adults that are within your home that are immunocompromised, where if they were to contract that particular disease could be devastating.
Right. It's really important when you consider exempting that child from the immunization. Don't count the information you get, for example, on the internet. There's a lot of false information on the internet. There's a lot of accusations and discussions, and it doesn't support the scientific background that comes with immunizations.
Right.
So we really encourage people to speak to their doctors. If they're considering not doing it, let the doctor give you an idea of why it'd be important to do that.
Okay, and the real reasons behind what you're doing to explore those. Now let's talk a little bit specifically about the immunizations available in those conditions that they or diseases they're protecting us against. I want to start with meningitis because there's been a lot that's happened with that we've seen nationwide and locally. Tell us about meningitis. There is a vaccination for it.
Right.
When should people consider getting it, and the disease, we'll roll into what is the disease. So tell us a little bit about the vaccination itself. There is one.
Meningitis can be viral or bacterial, and we have a vaccine for bacterial meningitis that's available, and usually it's aimed towards the preteen or the teenage child, and that child as they make that transition from high school into college. I know Oklahoma, and you need to check with other states, but some of the colleges that have campus dormitories where people are going to live in very close quarters actually require them to be immunized for meningitis before they report for their first year of college to live in the dormitories.
Right, and the bacterial is the sort of the most deadly form
it's more
compared
serious.
to viral.
Right,
Yes.
it's more serious, and it is very swift moving. It can come up with flu-like symptoms. So, and we've all had colds and flu, and we let that go on thinking if I just sleep this off, I'll be better. And within several hours, patients will develop rashes, and it'll become very severe, and some children can be gone, actually die within the first 24 hours of contracting meningitis. And so it's a frightening thing for parents when they read about these cases.
Right.
And we immunize in those preteen and teen years, like 11 and up. Although sometimes we see it in other age ranges that are a lot younger than that, but that's not the norm, and that's not the bulk of the amount of children. There's about 2,500 cases of bacterial meningitis in the United States every year that can result in amputation of limbs.
Okay.
It can also cause multiple organ failure. They can have kidney failure. They can have encephalitis. There's a lot of different things that can happen, and very serious. And there are people that they get sick, they go into the intensive care unit, and they fight and fight and fight, and sometimes it's a month before they actually die of it. But it's very tragic because it's so preventable.
Now let me ask this too in terms of how you acquire it. People may be wondering, okay, the vaccine is going to help prevent it, but people do get very afraid if someone within their environment had bacterial meningitis especially. So people are like, well, how do I get it? Is it,
well,
you know, because viral tends to be more of the airborne kind of thing. How do we get it?
Well, the bacterial meningitis, they would get that. We don't know whose immune system is working very well.
Right.
And it might be something that takes, as they say, it might take in one child and not in another.
Right.
If that one child has an immune system that's not working quite as well, it's taxed or stressed a lot. But it is in that communal kind of spirit where people are sharing out of drinking glasses and toothbrushes. If high schoolers have been out partying in the evening and they take away that prohibition, they drink out of someone else's glass, or someone wakes up in the morning without their toothbrush at college and they use someone else's. If their immune system's not up to snuff, they might go ahead and actually inoculate themselves inadvertently, and they can come up with meningitis that way. So it's that close kind of living that
Right, and
teenagers
sharing
do,
those
and
kinds
the
of
risks.
things, yes. And so when outbreaks occur, not only here, but health departments across the country often get involved with trying to determine who within that environment needs to have, if they have not had it, the vaccination, and that based on what you're saying, what's been shared, what's happening.
Right. The county and the state health people get involved. The immunizations service, they come in and they try to track down where it is, and they try to determine whether it's one case or 3 cases, and then they have to decide on how many people that were exposed to that need to be immunized, and they can develop their own immunity against it. And some of them are given prophylactically, is what they call it, before the disease. Given antibiotics, so they have to decide who needs to do that. And when we've had outbreaks of that, they study that, and the cost of the entire episode can be just staggering because of all the people that have to get involved.
Let me ask this in terms of switching to another area that's been pretty prevalent, looking at pertussis, that whooping cough. Tell us a little bit about pertussis.
Whooping cough is so easy to catch. Because it's in the airborne droplets. And so if you sneeze or you cough and you don't cover your mouth or your nose, someone else is very likely to get that. And we've had outbreaks in the last few years around the country to the point where we've had to declare several epidemics. California in 2010 had an epidemic, and they had about 9,700 cases that were reported. And they had 10 infants less than 3 months of age that actually died from having the pertussis disease itself, or whooping cough disease.
And this is a disease too that does impact the younger population sort of harder, hits them the hardest, especially with infants. So even as adults, you need to be immunized so that you're not conveying that to an infant, whether it's your own infant or someone else's infant.
Right. It's being recommended now that anybody who spends any time at all around infants or young children go ahead and get their Tdap vaccination. Grandma and grandpa, mom, dad, because mom is the #1 person that's most likely to give whooping cough to that little infant. And what we find is the infants are most at risk because they have the smallest little tubes that go down into their lungs. They're more likely to get clogged up with the mucus that develops in there and have they're unable to breathe. And so they gasp and they whoop, and that's characteristic of the disease in those little tiny tubes. But with adults, if you have a cough that lasts more than a week or 2, you really need to check with the doctor and make sure it's something that's not serious, because adults do not whoop because their airways are larger.
And it is a characteristic sound. We do have to go to break, but it is that, it is and you can even hear that on the internet. They have sites that you can go to whooping cough and click on it, and you can actually hear it if you're unaware.
It brings tears to your eyes.
It really does. And so I had mine, I want to tell before I go to break, I had my Tdap, and I want to say that I don't have any babies, but I want to protect everybody else's babies, because they're my babies too.
That's great.
So stay put. We're going to come back and talk about a few other areas.
Great. Thank you.
Please stay with us. We'll be right back.
In 1977, an 8-year-old boy picked up the game of golf from his father. The odds of that same boy then making it to the US and European pro golf tours, 1 in 7 million. The odds of the Big Easy winning the US Open twice, 1 in 1.2 billion. The odds of him having a child diagnosed with autism, 1 in 110. Ernie Els encourages you to learn the signs at autismspeaks.org.
Cook foods to the right temperature using a food thermometer. 3,000 Americans will die from food poisoning this year. Check your steps at foodsafety.gov.
Yes. Welcome back. We're going to complete our discussion talking about immunizations and vaccinations. Joining me again is Kathy Siebert. She's with the Tulsa Area Immunization Coalition, Tulsa Health Department. Let's jump in. Now, I do want to ask you about diphtheria, moving into that, because there are these combination vaccinations that we have going. What is diphtheria and what does it look like? Tell us a little bit about that.
Well, we don't see a lot of diphtheria anymore, luckily, but every once in a while, because in a lot of cases we say that when we've eradicated something from the United States, it's just a plane ride away. It can come back to us. And so diphtheria is something that is the most common disease that killed children in the pre-vaccine era. And it causes problems with being able to breathe, and it causes multi-organ failure. And it produces a toxin, and that toxin sort of poisons the whole system, poisons all the liver and all the other organs. And it's a very sad disease. My dad lost his 9-year-old sister before that particular vaccine was available here in the Midwest.
Okay, and so with the advent of the vaccination, and people actually having their child immunized for it, we've seen this eradicated.
We've seen it eradicated
in the U.S.
Right, in the United States. There are pockets around the world that still have it. Eastern Europe still has cases of that pop up, and a few years ago we did have some cases up in the Pacific Northwest. Little pockets of diphtheria popped up, and so it's very wise, very important to go through and get that.
Okay, and another thing too, because then I'm going to move into some other vaccinations here, but another thing, if we get an increase of people wanting exemptions for certain things, there's got to be a resurgence of these conditions that we're going to see.
That's what we're most worried about, because as I said, this is a preventative thing. And when people opt out of having these for whatever reasons they do, especially if it's just a personal preference, it's so wise for them to understand why they're opting out, because there is what's called herd immunity or community immunity, and we have to have a certain level. Sometimes it's in the 80s, sometimes it's in the 90 percentages that have to be protected against a disease. Otherwise, when it drops down, because, for example, people opt out, then if someone comes into that community with the disease, it'll spread again, and it can get away from us. There was a child who traveled to Switzerland. They were traveling Europe, and he was 7 years old and was purposely had taken an exemption. And when he came back to the United States, there was 839 people that were exposed to the case of measles that he developed. And 11 of the additional ones were unvaccinated, and 3 of those were infants, and one of them had a fever of 106 for 3 days in the hospital. And that one time, that one child caused an expense of $177,000 before the state was able to wrap up, quarantine, send county and state health officials in there. So not only is it uncomfortable or difficult for the families, but it spreads to other people, and it costs a lot of money.
Economic cost. Wow. Let me ask you about tetanus. How are we doing with that? Because there's a vaccination for tetanus.
Right. And now that we have the children that are vaccinated before they go into school, the DTaP, that's got the tetanus element in there. And then we're finding also with the pertussis, there's called a Tdap, and we're requiring a booster now for 6th and 7th graders for Oklahoma, but Texas and other states are also doing that. So everyone needs to check in to that, because we're finding that the vaccine, although it's not like the old vaccine, it doesn't last like having the original natural illness. And so that's why they're going ahead and requiring boosters to be given to children that are in that 9, 10, 11-year-old age.
And again, that's what the booster is. The booster is something to sort of revive and reinvigorate your previous one, in essence, to kind of kickstart it again, to say, okay, let's do some coverage here.
Right, and tetanus is something that is in the soil. That is the one thing that we will never be able to get rid of. If we could get all these vaccine preventable diseases in a box and toss it off the planet, we'd be in great shape. But we would always have soil or dirt, and we would always have tetanus in there. So these deep punctures, these dirty wounds can always have a possibility of causing tetanus. It's a muscle constriction across the body, and when someone gets very, very ill, they go to intensive care unit, they get put on a ventilator, they have to be sedated, and special procedures done to be able to pull them through to save their lives.
And now with the tetanus, it used to be where every 10 years or so you needed a booster. Is that still?
They are asking that anybody who hasn't had a Tdap shot, go ahead and get one, even if it's been a year or two since you've had it. Since you've had a tetanus shot, to get the Tdap now. So you get your booster for your pertussis and you get your tetanus, and then go back to the every 10 years through adulthood and get your tetanus shot. And they will continue to monitor pertussis and make sure that if they need to come back and have another booster done someday, it's only time that they need to watch and monitor these things to be able to decide if they need boosters.
Okay, I do want to switch in our last little bit here together, which is not a vaccine for it, but TB, tuberculosis. Tell us a little bit about that and kind of what people should be aware of in terms of testing for it. Or
well, tuberculosis is that's been a disease that's been around since time started, practically, and it's a very debilitating one. It can spread from person to person. If you get a TB test, tuberculin skin test, they can check to see if a particular person has it, and there are drugs that they can prescribe to treat that. And it takes months and several years to be able to do that in close physician monitoring. But we have some resistant types of tuberculosis that have developed in recent years, and so it's we don't want to get to a stage where we don't have an antibiotic or a treatment or a medication that would put that back in the box too.
And that's important to know, that you still need to get your screenings for TB as well. Now, in relation to the health department, which can mirror the health department anywhere, and people can sort of check where they are, your surveillance and immunizations being available, there is a federal program that's called Vaccines for Children's program, of which you participate in and some schools participate in as well, in terms of offering it to families. So if a person can't pay, and that's free of charge if they meet the criteria, there are programs that you have that are free that can provide these services or low cost.
Right. If the children are 18 years and under, and they're underinsured or uninsured or on Medicaid, or here in Oklahoma on Sooner Care, these particular kids are able to get these vaccinations, the required ones and some of the recommended ones, all the way up to 18. They're able to get those at no charge. And the health department's available, as it is for the tuberculin skin tests. The health department and physicians, private providers and clinics have that, and so do they have the immunizations, and they have the ability to check with each person that comes in to see if they qualify for vaccines for children, and then they'll be given at no cost.
Thank you so much for joining me and for helping us to understand.
Thank you.
Well, that's our show. For Health Alert, I'm Pam Butler. I'd love to hear your questions, comments, or suggestions for future shows. Please write me at Health Alert USA, P.O. Box 50913, Tulsa, Oklahoma, or if you're on the email trail, please email me at healthalertusa@gmail.com. And also visit me on YouTube at youtube.com/Health Alert USA. And remember, as we say here in Oklahoma and maybe other places too, be wise and immunize. Take care.